MCAS is when we're seeing that more of a systemic response related to the mast cells, right? So the histamine tolerance is usually more related to food. We're not able to digest and deal with that histamine in and around meals. But the mast cell or mast cell activation syndrome is exactly in its name. Our mast cells are getting more hyperactive and more activated, and that's leading to a syndrome or a complex of symptoms. And so they're releasing histamine and other inflammatory chemicals, like we talked about, in response to stressors, in response to viruses, in response to shifts in our blood sugar throughout the day, in response to the foods that we're eating. And then we're starting to see that systemic symptom picture. So if it's affecting your skin, you might have that flushing, the hives, the swelling, the itching. If it's affecting your gut, you might have more looser stools, diarrhea, bloating, nausea, abdominal pain. If it's affecting your brain, which we often forget about, that histamine receptors are everywhere in the body, right? So it's not just affecting those classic organs, but it can affect your brain, leading to anxiety, irritability, brain fog, sleep issues. It's affecting your heart. It can lead to dizziness, palpitations, low BP, and sometimes we see that intersect with MCAS and POTS. And then if it's affecting your lungs, we can see that asthma-like picture, the congestion, the wheezing, the throat tightness, right? And so oftentimes patients come in and the symptoms are just feeling so random, it's so overwhelming, but it really does boil down to one or two things.